Good afternoon, everyone. My name is Peter Singh, and I'm your MLA for Calgary East constituency. And I will be your MC today as well. As we begin, I want to acknowledge that we are gathered on the traditional territories of the peoples of Treaty 7. We honor and respect the many indigenous people who have lived on and cared for these lands for generations. I am so proud to welcome you to the Calgary Recovery Community, located in the heart of Calgary East constituency. Today we are joined by Premier Danielle Smith, Minister of Mental Health and Addiction Rick Wilson, as well as Jared Nielsen, Alison Kareem McSweeney, Executive Director of International Avenue BRZ. And also in attendance is Mayor Jyoti Gondar of the City of Calgary, Mr. Jashraj Hallan, Member of Parliament of Calgary East, and Councillor Andre Chabot. This is an important day for this community and for Alberta. It marks another milestone in our government's ongoing commitment to building the Alberta recovery model and addressing the addiction crisis affecting communities across our province. As the MLA for Calgary East, I know that we will benefit firsthand from having a facility like this that will help more people get on the path to recovery and hope for a better future. I also know this is a cause our Premier cares deeply about, and it's a top priority for our government. Under her leadership, Alberta has taken bold steps to address addiction through the creation of recovery communities, safe, supportive spaces where individuals can rebuild their lives. These centers reflect a shift towards long-term, community-based care, emphasizing healing, dignity, and hope. So please join me in welcoming Premier Danielle Smith to the podium.
Well, thank you so much, Peter, for hosting us today and for emceeing, and good afternoon to all of you here. I'm joined by Rick Wilson, Alberta's Minister of Mental Health and Addiction. Also, you will hear from Jared Nielsen, Executive Director of Last Door Recovery Society, and Alison Kareem McSweeney, Executive Director for the International Avenue BRZ. Nice to see you as well, Mayor Gondek. Nice to see you as well, MP Jasraj Hallan, and nice to see you as well, Councillor Chabot. We are also joined by others who work on the front lines to heal those struggling with addiction. It's challenging work, and I have the deepest appreciation for your commitment to Albertans with substance abuse and addiction issues. Addiction can be a dark place of despair and devastation. It brings pain to those who are struggling and feelings of helplessness for their families and loved ones. It also takes a huge toll on society. The social cost, as well as the impact of on Alberta's economy and our justice and healthcare systems, is more than $7 billion annually. When our government took office, we refused to stand idly by. We also refused to feed the cycle of addiction by making illegal drugs more accessible, like many other governments have done. Under our government's leadership, Alberta is on the forefront in addressing mental health and addiction. Since 2019, we've been focused on a new and better approach, the Alberta Recovery Model, a comprehensive system of mental health and addiction care that includes prevention, treatment, and recovery. We're focused on increasing access to treatment, removing barriers to care, and making treatment immediately available. And we're seeing some early signs of success. In 2024, opioid deaths in Alberta decreased by 39% compared to 2023. Prescribed opioid overdoses are near zero, and deaths from methamphetamine and alcohol are down significantly. And all of that is helping to ease the pressures on our healthcare system. In 2024, EMS responses associated with opioid-related events were down by 37% compared to 2023, and emergency department visits related to opioids decreased by 26%. Hospitalizations related to opioids decreased by 10%. So far in 2025, every month with reported numbers has had lower opioid deaths than the same month in the last 4 years. These numbers tell a story. What we're doing is working, but we, of course, do have more work to do. That's why I'm so very proud to announce the official opening of the Calgary Recovery Community. This is Alberta's 4th recovery community, expanding the network of recovery communities already open in Lethbridge, Red Deer, and Gunn near Edmonton, and moving us closer to our goal of establishing 11 recovery communities across Alberta by 2027. Today's opening will bring hope and help to men suffering addiction in and around Calgary. The 74-bed facility will offer time, structure, and support, including a range of services to help clients pursue recovery and rebuild their lives. Clients may stay here for up to a year, but we know that life and its struggles continue beyond their time at the facility, and that's why staff will help clients develop a transition plan to access ongoing support before they leave. The goal is for each client to leave the recovery community drug-free, ready for work, or to begin training, and with a solid plan to get continued help from strong connections close to home. We're partnering with the Last Door Recovery Society to achieve that goal. They have the experience and commitment to recovery-focused care, and they're the right choice to lead this life-changing work. Every Albertan deserves the opportunity to heal, reconnect with their community, and rediscover their purpose. And every Albertan who is struggling with addiction deserves help to recover and rebuild so that they can go on to lead a healthy, happy, and fulfilling life. Many Albertans have their own stories of recovery, and many more will walk through these doors in the future. And all of you, I admire your courage, and I am inspired by your strength to change your life. I wish you all the very best. I also want to thank the team at the Calgary Recovery Community, the Last Door Recovery Society, and everyone who has worked so hard to make this project possible. And now I'd like to invite Minister Rick Wilson to share more details about this facility.
Thank you, Premier, and thank you everyone for coming today to help me join in opening the Calgary Recovery Community. This is an exciting day. I literally had goosebumps this morning. I met the founder of the Last Door this morning at breakfast, and there's so many good people that work in this field that it's just an honor to be part of it. I see Mayor Gondak is here with us. Thank you for making the time, and Councillor, MP. What a proud and hopeful day as we celebrate the grand opening of Alberta's 4th recovery community, located in one of our province's largest urban communities, of course. The facility we are currently standing in is going to be a place of healing and transformation, offering those struggling with addiction the support, the structure, and the time they need to rebuild their lives. Recovery communities are an important part of the work being done under the Alberta Recovery Model, and they focus on ensuring anyone struggling with their mental health and addiction has access to the evidence-based care needed to pursue their recovery. Since 2019, we've made significant strides to accomplish this goal, including eliminated user fees for publicly funded treatment, expanding access to same-day addiction medicine treatment through the virtual opioid dependency program, and adding more than 10,000 publicly funded live-in addiction treatment spaces. We know the need is great, which is why our government is continuing to invest in building facilities. Sorry, I've just seen the need out there and it's heartbreaking. It's going to increase mental health and addiction capacity in Alberta. This includes building 11 recovery communities, like Premier said, across the province, 5 of which are being built in partnership with Indigenous communities. Recovery communities in Lethbridge, Red Deer, and Gunn are currently open, and the impact of these facilities that are making on the lives of those struggling with addictions is remarkable. Our top priority is providing more Albertans with access to the holistic and the therapeutic care within recovery communities. Once completed, these 11 recovery communities are going to add more than 700 long-term addiction treatment beds to the mental health and addiction care system. That's going to provide more than 2,000 people a year with a path to recovery. And that's what today is all about, opening the doors to a facility that's going to serve as a home while residents focus on their recovery. We did this with a capital investment of more than $9 million, supported by the development of the Calgary Recovery Community. Renovating this vacant government-owned facility allowed us to expand access to long-term addiction treatment in the heart of Calgary, where addiction treatment capacity is critically needed. This 74-bed facility began welcoming its first clients just in August. I see some of them back here. This is amazing. Residents here are already receiving comprehensive evidence-based treatment, and that includes individuals and group therapy, the development of healthy habits and social skills, employment training and supports to set residents up for success once they're ready to leave their recovery community. Our goal is that when clients leave this community, they do so with renewed purpose and the tools they're going to need to live healthy, purpose-filled lives. To this end, we've partnered with Last Door Recovery Society, a nationally recognized leader in addiction treatment, to operate the recovery community. Their extensive experience in delivering evidence-based addiction treatment programs is going to provide every person who walks through those doors with the help that they need. With this new space, hundreds of Albertans each year are going to have the opportunity to rebuild their lives, reconnect with their communities, and rediscover their purposes. This recovery community, it's more than just a building. It's a symbol of hope, resilience, and the belief that recovery is possible for everyone. And you're going to hear me say that a lot. It is possible for everyone. Above all, it's a place for people to build a brighter future, not only for themselves, but their families, loved ones, and the communities surrounding them. I just want to again thank everybody for being here to help us celebrate this important milestone. And I'm going to invite Jared Nilsson, the Executive Director with Last Door Recovery Society, to share a few words. Thank you.
Hello and good afternoon. My name is Jared Nilsson. I'm the Executive Director here at the Calgary Recovery Community. I just want to say thank you for everyone that came here in attendance and to see the place and stuff like that. So thank you very much for coming today. So the opening of this recovery community reflects the Government of Alberta and the Ministry of Mental Health and Addictions' strong commitment to recovery-focused services that uphold dignity and hope. Under Premier Danielle Smith's leadership, Alberta has embraced the Alberta recovery model, making treatment more accessible than ever before and positioning the province as a national leader in building a recovery-oriented system of care. Far beyond policy, the Premier's vision speaks to a future built on hope, dignity, and most importantly, strength. We're deeply grateful to have Honourable Rick Wilson, Minister of Mental Health and Addiction, and his team, whose professionalism, collaboration have been essential to getting this initiative done. Good feedback. As you can see today, this facility has been repurposed to a 74-bed recovery community for men. It offers a welcoming and therapeutic environment where clients may stay for up to 12 months. Clients will benefit from shared and private rooms, a gym, dining hall, community spaces, medical spaces, and a new kitchen, because dignity, including a good meal, is part of recovery. Here we will deliver evidence-based therapeutic community model, emphasizing peer support, accountability, and social learning. Services include group and individual therapy, cultural and peer support, mutual support, men's health, employment preparation, and strength-based programming that builds recovery capital, strengthening personal, social, and community well-being. The Calgary Recovery Community is more than just a building. It sends a powerful message to Albertans living with addiction and to their families. Recovery is possible, and in Alberta, recovery is supported, attainable, and it's sustainable. Yeah. To our recovery community partners, many who the leaders are here today, thank you for the foundation you guys have laid. You know, it's a really big deal for this to happen, and we're just happy to be able to celebrate with you guys and build upon it. To the East Calgary community, thank you. During our community development, we spoke with many individuals in this neighborhood, and we really want to recognize Allison Kareem McSweeney, Wendy Whitehouse, and Larry Leach. Through our conversations, we've come to appreciate this neighborhood's history, its needs, and most of all, the heart of what makes it so special. We are grateful for your warm welcome as neighbors and partners. Finally, on behalf of the Last Door Recovery Society, extend our deepest gratitude for the Government of Alberta, community members, the recovery organizations here in Calgary, and to every individual whose dedication has transformed this vision into reality. The Calgary Recovery Community now stands ready to provide life-changing services that will strengthen individuals, uplift families, and empower communities for generations to come. So thank you for sharing this special day with us. I will now bring up Allison Kareem McSweeney.
Madame Premier, Minister Wilson, Mayor Gondak, MP, Andre Chabot, Councillor, and distinguished guests. Thank you so much for including the International Avenue Business Revitalization Zone in the opening celebration today. Our organization has worked for decades to make 17th Avenue, International Avenue, and the surrounding communities a better place to live and shop. We've also done our best to make it safe. Despite the amazing collaborative work we've done, including the $176 million reconstruction, which has made the avenue one of the most beautiful and progressive streets in the city, we have faced overwhelming challenges in the recent years. Parents are often afraid to let their children walk to school because of the large and growing unhoused population being exported from downtown into our community. These people unfortunately often suffer from addiction disorder and mental health issues, which leads to social disorder, discarded drug paraphernalia, vandalism, crime, and trauma. A lot of the population has been exported to our neighborhoods from other parts of the city, and many agencies are doing their best to support the population, but are focusing on outputs, not outcomes. That distinction is very important. It's time for a new approach, and I'm here to tell you the current system isn't working in East Calgary neighborhoods and much of Calgary. That's why I'm happy to be here today. Admittedly, when we first were approached by the Minister of Mental Health and Addiction, we were concerned that this would be yet another agency which meant well, but whose work provides unintended consequences to a neighborhood and little accountability. This is not the case here with Last Door Recovery, however. I can tell you, I'm not worried any longer, and in fact, I'm really excited. It's going to be a huge game changer for the community, one from crisis to recovery, one from despair to one of hope. The Alberta government has taken the necessary step to start to deal with the systemic changes of addiction disorder and the collateral damage that comes with it. It is a bold move, and it is very needed. Thank you so much for that. Once I was introduced to the leadership team from Last Door, I could fully understand the work that they've been doing and how they change people's lives. I felt excited to welcome them into our community and much more comfortable because it's about accountability. And let me just say that again, it's about accountability. We are tired of the collateral damage of our residents and businesses being expected to bear the real economic, personal, and social costs of the current situation. Many of more than our 435 member businesses of our BRZ, for example, pay for an innovative private security initiative, and we also co-manage the Ambassador program with 12 Community Safety Initiative. To date, we've gotten 230 people off the street through our program. Our team, however, is faced daily with saving people's lives from overdosing on street drugs, sometimes many times a day, for the same person. I want to reiterate that we need to do things differently to help people out of the crises they are experiencing and to bring people and communities up, not leaving them in place to continue to damage their lives and impact those around them. I believe Last Door has already shown real concern and accountability to the neighborhood. Rather than supporting people to live on the street where they face the daily threat of becoming a fentanyl or methamphetamine statistic, Last Door is providing a door to the much better future. A center like this feels like the way forward. Rather than doing nothing to fix the issues, Last Door supports individuals in tackling the systemic issues of addiction disorder and providing wraparound services that support their recovery, including creating positive economic spin-offs in the community. They are going to be part of the community, not just working in our community. It's an investment that I believe will pay multiple dividends in the future, helping to recapture the lost productivity and human potential of the clients, and in the process also investing in the neighborhoods they serve by providing hope for the individual and the community. It is indeed a new day, one from addiction to one of recovery, and it's a very exciting future indeed. Thank you.
Thank you, everyone, for such an inspiring words shared during this special occasion. Your patience and support remind us that recovery is not just a personal journey, it is a community commitment, and today is truly an exciting day. It is deeply meaningful to know that this space will offer individuals a pathway to recovery that is rooted in dignity, compassion, and evidence-based care. More than pride, what I feel today is a profound optimism. It is optimism for the lives that will be empowered and renewed through the wraparound supports and services available here, and seeing the Alberta recovery model in action. It's about supporting people in need every step of the way on their recovery journey. With that, I will turn it over to questions and then move outside for the official ribbon cutting, followed by facility tours. Now I will invite Sam for the questions. Thank you, everyone, for coming.
Thank you. Thank you. We'll now go into our media Q&A. We're running a little short on time, but we'll start off with questions here in the room before making our way to the phones. Just a reminder to media to please state your name and outlet before asking your question, and we'll go with one question and one follow-up. Go ahead to our first at the mic.
Hi, Matt Skase, Canadian Press, as for the Premier. On COVID shots, what was the reasoning behind extending coverage for COVID shots to healthcare workers? And on top of that, how much will it cost for the province to extend that coverage to them?
It was a request of the Health Sciences Association to add it, and in consultation with other unions, they wanted to be able to offer it to their members. It won't be mandatory. It'll be certainly by choice. As you know, during a respiratory virus season, there's a lot of patients who go into a hospital setting, so they're exposed to COVID, influenza, and RSV. And any healthcare professional who wants to take an extra measure of protection, we were happy to support them on that. That was the reason for the change in policy. And then we'll do another announcement, I believe is coming tomorrow, to get some more clarity on what the costs are.
Okay, thanks. Shifting over to disclosures, your former cabinet minister, Peter Guthrie, says that nothing happens in this government that doesn't go through you and your chief of staff. So were you unaware of the changes to receipt disclosures that were publicized on August 1st and then by news reports?
Yes, I was unaware. As I explained when I was asked about this at a town hall, the direction from cabinet was that there were some members of my caucus and cabinet who were concerned that they stay at the same hotel every time, and they were worried, especially since it's getting more and more dangerous to be a politician, as we've seen in the United States. They were worried that there's a potential for them to be protested or approached or in some way put into harm, and so the direction was to find a way to redact that information. I think something got lost in translation, and so we've gone back to the original intention of the cabinet direction, which was to maintain the posting of receipts, but to redact the hotel information so that we can put the safety of our caucus and cabinet members first, which was the intention.
Thank you.
Yeah.
Go ahead.
Hi there, Mark Villani with CTV Calgary. Just a question about Last Door Recovery Society. A couple of years ago, it appears they were caught up in a sex abuse scandal where one of its employees in BC was convicted of sexually assaulting vulnerable women. Questions remain about what Last Door management knew about and when. Was this considered as part of the procurement process when awarding the addictions treatment contract to Last Door?
The sad part about any field where vulnerable people are taken care of is it sometimes attracts predators. And you don't know a person's a predator until it's been discovered. I'm glad to see that it was dealt with in an appropriate way, and anyone who faces any kind of criminal behavior should be dealt with that way. But I think that we have to look at holistically what happens in an organization, and I think that the record of Last Door speaks for itself, and so we're very pleased to be able to partner with them on the outcomes that they can achieve.
Okay, and just to follow up, we're hearing reports that thousands of Albertans' personal health data is still being held by Last Door Recovery, which built the My Recovery Plan app. Can you guarantee that that data will be deleted and not retained or shared once the app is shut down?
The approach that we take is to try to have non-identifiable data so that we can do the analysis and do the aggregation, but not have any particular unique identifiers that can be traced to an individual patient. So certainly I'll follow up with with the department. I don't know if Minister, it might be a new question for Minister Wilson since he's new in the portfolio. I'll see if he has anything to answer on that.
Yeah.
Yeah, we've, as the whole recovery system is evolving, the technology is also evolving. So what we're going to do is, until the new app is developed, we'll carry on with the old one. And then as outcomes continue, it'll all be redacted from their system. But at this point, the two systems will be running in parallel until we get the new app up and running, and then it'll be taken care of.
Thank you.
Thank you. Do we have anyone else at the mic in the room here? And seeing none, we're going to head over to the phones. Operator, would you be able to put through our first caller, please?
Our first question is from Rahim Mohammed of Post Media. Your line is already open.
Sure. Hello. First of all, congratulations to everyone assembled. I know today's been a long time coming. My question is for the Premier. Premier, I wanted to get your reaction to an incident, I believe, in Lindsay, Ontario, where a man is now facing criminal charges for defending himself from a home intruder. What are your thoughts on that situation?
Well, if you don't want to get shot or beaten up, don't break into people's houses. It's pretty straightforward. We had a similar incident in Alberta where somebody defended themselves, and they determined that there was not a reasonable likelihood of conviction, because we do expect that people are going to use a reasonable use of force to defend themselves and their families, and I support that.
And just in terms, as a quick follow-up, in your dealings so far with Prime Minister Carney, I think he's been Prime Minister in the neighborhood of 150 days so far. Has he given you any confidence that you'll see a different approach to these sorts of situations than the soft-on-crime approach of his predecessor Justin Trudeau?
I think we'll wait and see in the fall. We have certainly, as premiers, made the case to him, and I can tell you it's every premier of every political stripe, that we all have had instances where somebody has been released on their own recognizance and then been repeat offenders, sometimes committing murder. So we know that this is a problem that needs to be solved through legislation. They had attempted to do that in the past. I don't think it went far enough. But we have all, as recently as our most recent First Ministers' Conference, have put that in our communique, and we would expect that it would be dealt with at the federal level when they return to session in the fall.
Thank you. And we just have time for one more question. Operator, could you put through our next caller on the line?
Next question question comes from Michelle Del Fontaine of CBC. Your line is already open.
Thank you. Just a question for the Premier. The BC government has confirmed that Albertans who are Canadian residents can get a publicly funded COVID-19 shot in BC at public clinics. So I'm wondering what this says about your COVID vaccine policy, that Albertans may have to travel to another province to get one for free.
Well, we're being very transparent about the issues that we face. This was a vaccine that was covered for 3 years by the federal government, and they chose to stop funding it. And so we had to make an assessment of what it would cost us if we resumed covering it in the same way that they did. The challenge is that fewer and fewer people each year are choosing to seek the COVID vaccine. Last year it was only 13.7%. And so we have a mismatch of how much we're ordering versus what the demand is. And so when we went back and looked at how much was getting destroyed or thrown away, because remember, it was being packaged up in packages of 10, you have to store it at a very low temperature. What we found last year was that 54% of the doses were spoiled at $110 per dose, which is what the average cost was. Over 3 years, it's about $284 million in Alberta alone that has been destroyed. So I can tell you we don't want to carry on with that kind of approach. We want to make sure that those who need it get it, and so that's what we're going to be doing, is assuring anyone who has pre-existing conditions over age 65, immunocompromised, or living in a congregate setting can get it for free. And then anybody who wants it for peace of mind has the ability to pay for that. But we're going through a process where people can sign up for it. And I think we have, last I checked, we already had over 100,000 people who'd signed up. It doesn't become available until October, so there's still lots of time for those who want it to be able to sign up.
Okay, so if the problem is wastage, why don't you just have people register for the shots and pay for them? So anybody could get them for no cost, just like in every other Canadian province.
Well, we'll try it this way. This year we are trying to mitigate costs because it is an expensive intervention. We don't pay for every vaccine. The shingles vaccine, for instance, we don't pay for. The RSV shot, we only just started paying for it for those over age 75. That's a $300 shot. When people go traveling and need a yellow fever shot, they pay for that themselves. So we don't pay 100% of the cost of every vaccine. So we're just trying to align our approach on COVID with the same approach that we're taking on RSV.
And that's all the time we have for questions today. Thank you, everyone, for joining us.
Thanks, everyone.